Dear students, I welcome all of you. Myself, Dr. G.S. Bhopalkar, Department of Chemistry, Rajiv Gandhi Mahavidyalaya, Mudkhed. This is the online teaching during lockdown period due to COVID-19 pandemic. In the last period, we have discussed about the introduction and classification of drugs. In this session, we will discuss about in details the functional drugs and what are the examples. Now, as I have already told that the definition of functional drugs are those drugs which stimulate or depress to the various function of the body to get relief without curing the disease. Such drugs are called as functional drugs. And these functional drugs do not directly attack on pathogenic microorganism, means the infected tissues or cells cannot be directly damaged. Now, these functional drugs includes the antipyretic, analgesic, anesthetic, antifungal, antidiabetic, anti-inflammatory, sedatives, and hypnotics, as well as tranquilizers. Means all these drugs are included in the functional drugs because all these drugs stimulate or depress to the various functions of the body. That's why the patient feel reliefs or patient get a relief from the pain. Now we will see one by one in detail what are these different drugs. Let us we will see first antipyretic drugs. Now what are antipyretic drugs? I have also already told in the last periods or last sessions. The antipyretic drug is the drug or compound which is responsible to lowering the temperature of feverish patient or organisms. Means if any person is suffering from fever, at that time its body temperature get increases. Means these antipyretic drugs work to lower the temperature of feverish organism to the normal body temperature. Means from feverish temperature to the normal body temperature, and it has no any effect on normal body temperature. Means after taking or administering the antipyretic drugs, our body temperature could not get completely lower side. Means it completely not decreases to the 0 degree Celsius. Means the body our body temperature will be maintained. Means because of antipyretic only the feverish temperature gets changes into the normal body temperature, but it has no any effect on the normal body temperature. Such drugs are called as antipyretic drug. Okay. Now I this thing I have already told you that about the antipyretic. Now the better example for the antipyretic drug is paracetamol. Antipyretic drugs are also found in analgesic property. Means I have already told that the antipyretic drug as well as analgesic drugs. Now, paracetamol is acts as a antipyretic drugs as well as analgesic. What are analgesic? We have to discuss in detail in the next point. I have already told about the antipyretics. Just the meaning is that meaning of anti-analgesic drug is to release the or to decrease the pain. Means there are two types of drugs, means antipyretic and analgesic drugs. They are studied together because antipyretic and analgesic are having the approximately same property. That's why they have studied all together. Now antipyretics drugs are not analgesic. Antipyretics are not any effect on the body temperature when it is taken by the patient or administration by the patient. Now, after taking the antipyretic drugs or administration the drug by the host or patients, then what will be the action of this antipyretic drug? Now, to maintain our regular body temperature in our body, there should be the balance in between the production of heat and loss of heat. Means this is the natural phenomena. In our body there is a continuously production of heat as well as loss of heat is get maintained. Means there is a regular body temperature as well as loss of heat is get maintained, and this balance can be maintained by CNS, means central nervous systems. Means the central nervous system, especially which part? Hypothalamus, and that hypothalamus is called as thermostat. Means whatever the regular body temperature is get maintained in our body to balance the between the production of heat and loss of heat. This process is get maintained by central nervous system, especially hypothalamus, and that hypothalamus is called as thermostat. Then in purest patient, what happened? The balance between the production of heat and loss of heat is also get maintained. But the thermostat, means the hypothalamus, is set at the higher level. Means in normal patient or normal human beings, the thermostat is set at normal temperature. But if the feverish patient is there, when the patient is having fever, in such cases also the production of heat, loss of heat is also get mentioned. There will be the balance in between the production and loss of heat. But only the thermostat is set at the higher level from the normal level. Means because of the thermostat is set at higher level from the normal level, the feverish person is get suffering from fever. Then after administration the antipyretic drugs, then what is the role of antipyretic drugs? The role of antipyretic drug is to reset to the thermostat. Thermostat means which one? Hypothalamus. Reset to the thermostat for the normal temperature. And during this course, the heat production is not completely inhibited, and heat loss, only the heat losses get increases. Why? Because of the peripheral blood flow in our body. Therefore, subsequently the patient having a fever is, its temperature is get lower side to the uh, towards the normal temperature. Means, in short, the action of antipyretic drugs is the in which the production of heat and loss of heat is important, and that can be maintained or balanced by CNS. Because of hypothalamus, it is called as thermostat, and in case of fuel dispersion, both the process production of heat, loss of heat is get maintained, but only the thermostat is get set at higher level. And after taking the antipyretic drug or paracetamol, in which the thermostat is get again reset to the normal temperature, and then the loss of heat is get increased, then the normal patient become to the normal body temperature. This is called as action of antipyretic drugs. Now there are number of example. I already told that the example is become paracetamol. Now the next drug is analgesic drug. What is analgesic drug? Analgesic drugs are those drugs which are used to relieve the pain without loss of consciousness. Means the analgesic drugs, what is the role of analgesic drugs? To relieve the pain, to get the relief from pain. But how? Without loss of consciousness. Consciousness is important. Means our consciousness is completely present, but we feel better, we get a relief from the pain. Such a drug is called as analgesic drugs. Now, as mentioned above, the antipyretic drugs as well as analgesic drugs both have been studied together. Means, in which, because there are some properties are similar, because the analgesic action of nervous system get decreases for the sensation of pain. Means while taking the antipyretic drugs, while administration the antipyretic and analgesic drugs, both these drugs are acts on the central nervous system, and they are help to reduce the sensation of pain. Means on the basis of this CNS, central nervous systems uh, central nervous systems, the sensation of pain is decreased, and depending upon these analgesic actions, these analgesic drugs are divided into two groups. The first one is narcotic drugs and second one is non-narcotic drugs. Means the both are having the same function, narcotic, non-narcotic. Means they reduce the pain without consciousness, without loss of consciousness. But some are narcotic, another are non-narcotic. Now what are narcotic drugs? Narcotic drugs are those drugs, they produces sleep. Means it produces analgesia and sleep, and because of high dose causes unconsciousness. If then, for example, I think you have known about the opium, morphine, codeine, all these are the drugs. Means these drugs, when the dose of this drug is having become more, means at high dose of opium, morphine, and codeine, these drugs produces analgesia. Means it relieves the pain, but they produce the sleep. Therefore, these drugs are the narcotic drugs. Then what are non-narcotic drugs? Non-narcotic drugs are not addictive. They are antipyretic in effect. Now, why they are not addictive? Because they are normal drugs. They do not produce any sleep. But narcotic drugs, they produce sleep at higher dose. This is the difference, and because of this produces sleep and they relieve the pain, they become a addictive drugs. Means once the patient has administration these drugs, and if it become a habitual with the drugs, then at that time it is very difficult to give these drugs. It is difficult to avoid these drugs. Therefore, analgesic drugs are important, that is narcotic and non-narcotic, and difference between them is narcotic produces sleep, non-narcotic do not produce sleep. Narcotic are addictive drugs and non-narcotic are not addictive drugs. The examples are aspirin and analgesics. Means these are the examples of analgesic drugs and antipyretic drug, that is paracetamol, phenacetin, aspirin and antipyrines. All these drugs are used as a antipyretic as well as analgesic drugs. Apart from these drugs, there are some other drugs are also used as analgesic, that is ibuprofen, indomethacin, methadone, nolafine, fentanyl, number of drugs, that is pentazocine, then antipyrine, amino antipyrine. All these drugs are used as antipyretic drugs as well as analgesic drug. Now, next drug is anesthetic drug. What are anesthetic drugs? The term anesthetic, which is derived from the Greek word that is anesthesia, and its meaning is insensibility. It produces the insensibility in our body. Now, anesthetic drugs which produce the insensibility to the vital functions of all types of cells. Means once the anesthesia is given to the patients, at that time it produces completely insensibility to the vital functions of all types of our human body or cell, and especially nervous system. Nervous system is more important to produce the insensibility in our body. Okay, because of these anesthesia drugs, the action of drugs on the central nervous system, which produces the insensibility to the vital functions of all types of cells. Now, anesthetic drugs are reversible in effect. Means once the a specific concentration of dose is given to the patients, means if we given the 2 ml of anesthesia to the patients, means whatever the concentration is present in the human body or patients, and at that time it produces insensibility. But after the decreasing of concentration of given anesthesia in the body, at that time the affected organs again return into the normal positions, again return into the normal temperature. Therefore, the anesthetic drugs are in reversible effect, and these anesthetic drugs produces temporary insensibility to the pains. Means it is the temporary effect. They produce temporary insensibility in the body. And therefore, because of this action of this drug, why? Temporary insensibility, then reversible effect, it produces insensibility. That's why these drugs, anesthetic drugs, are used in the major and minor surgical operations. Means in all surgical operations, these anesthetic drugs are used. And it is drug should be the satisfied all the ideal characteristics for the anesthesia. Now these anesthetic drugs should be, it has been divided into two groups, general anesthetic and local anesthetic. Then what is the between general anesthetic and local anesthetic? General anesthetic drugs means which produce unconsciousness all over the body. Means the because of these anesthetic drugs, the all the body uh, feel unconsciousness. Therefore, it is used in major surgical operations. But what is the local anesthetic drugs? The local anesthetic drugs do not produce the unconsciousness to all over the body. It only produces the unconsciousness, only the affected part of the body. That's why such a drugs are called as local anesthetic drugs. Means why? Because only the get affected part get unconsciousness because of the local anesthesia, and general anesthesia it produces insensibility to all over the body. Now the examples of anesthesia are the nitrous acid oxide, N2O, ether, divinyl ether, metoprolol, cyclopropane, chloroform, cocaine, alpha-euphocaine, orthocaine, benzocaine, propane, or xylocaines. All these are the examples of anesthetic drugs. Okay. Now the next drug is anti-diabetic drugs. Now, what is anti-diabetic drugs? Now, anti-diabetics is more important. Nowadays, it is more important because the diabetes is a disease. It is disease which is caused by the deficiency of effective insulin. Now, if deficiency of effective insulin, if the effective insulin is not produced properly in our body, at that time it become diabetic. Therefore, what is the insulin? Insulin is a hormone which is secreted by the beta pancreatic cell or pancreatic beta cells. Means insulin is the most part of in our body because this is more important hormones, and this hormone gets secreted from the pancreatic beta cell. Then what is the role of insulin? This insulin can control, means it controls on the metabolism process, means it metabolism of carbohydrate as well as lipids and proteins. Means whatever we are taking food in the form of carbohydrates, lipids, proteins, that that insulin control the metabolism of all these factors, that is carbohydrates, lipids and proteins. Then the diabetic is not able to metabolize glucose at normal rate. Now what happens? If the secretion of insulin is not working properly in our body, at that time it is not able to metabolize the glucose, carbohydrates, lipids or proteins in our body at a normal rate. Means the what happen? Subsequently or automatically the blood glucose level of patient is get increases to the higher level from the lower level. Means because of the insufficient insulin in our body, it cannot be controlled to metabolize the carbohydrate, lipids and protein. That's why patient become a diabetic because the glucose is present in our body at normal, not a normal rate. It become higher level, and due to the higher level of glucose in our body, at that time the patient is become a hypoglycemia, and after the sometimes the level of glucose returns to the normal level, but it is very slowly. That's why the person is considered as a diabetic person, and it causes the adverse effect like other diseases, polydipsia, polyuria, glucosouria, ketouria. All these are all the patients feels weight loss also and muscular weakness. These are the symptoms of diabetic persons. Means because of the presence, because of the hypoglycemia in our body. Then what is hypoglycemia? the glucose level in the blood is become very high, get increases at higher level, and it returns to the normal level very slowly. That's why this is happened, because of the insufficient insulin is secreted in our body that cannot be controlled the metabolism process. And because of this hypoglycemia, all these it causes polydipsia, polyuria, glucosuria, ketonuria, weight loss, and muscular weakness. These are the symptoms of diabetic persons. Now, if the patient is having diabetes, at that time he required some drugs, and the role of drug is which is helps to secrete the insulin in our body, which increase the rate of secretion of insulin in our body. Then the metabolism of carbohydrate, lipid, and protein get maintained in our body. Now, this diabetic is having two stages. It is found in two stages. Number one, juvenile diabetes, and second one, maturity diabetes. Juvenile diabetes are the patients, or these are the patients. There is a completely absence of endogenous insulin. Means in juvenile diabetic person, there is a completely absence of endogenous insulin, means secretion of insulin is completely absent in the juvenile person, juvenile diabetes. But in case of maturity diabetes, the diabetes is found in above 40 years of patient, and in which the insufficient quantity of insulin is present. Means it has such a patient or such a person is not having sufficient insulin in his body. That's why it cannot control the metabolism of carbohydrate, lipids, and protein. That's why such a maturity diabetic become a hyperglycemia. Now there are some examples. These, that is glucose, mannose, amino acid, glycogen, tolbutamide, sulfonylureas, which are used to secrete the insulin in a diabetic person. Therefore, the diabetic person required the tablet which are useful to secrete the insulin in his body. Then and then the body or the insulin can control the metabolism of carbohydrates and lipid. This is about the anti-diabetic drug, and this is the one of the familiar example, that is tolbutamide is the anti-diabetic drug, and this is the structure of tolbutamide. Okay. Then next drug is tranquilizers. Then what are tranquilizers? Tranquilizers are the drugs which are used for the treatment of mental disorder. Those person has suffering from mental disorder, for such cases the tranquilizers which are used for their treatment. Then what is the role of these drugs? Means those drugs which are used for the treatment of mental disorder, they are called as tranquilizer. But what is the role of this tranquilizer? This role of tranquilizer, they produces the specific improvement in the mood of patient as well as behavior of the patients. Means because of the tranquilizer, if the patient is suffering from mental disorder, at that time he need to have tranquilizer drugs, and after administration and taking the tranquilizers, its its mood is get changes. There will be the improvement in the mood of patients as well as behavior. So those persons have suffering from mental disorder, such patients are called as psycholeptic. Means those drugs which are used for the as a tranquilizer because of the psycholeptic. Why? Because these drugs can decrease the psychomotor action without causing sedation. Means after taking the tranquilizer drugs, these drugs reduces or decreases the psychomotor action of patients. Therefore, the tranquilizers drugs are used to reduce the mental tensions and relieve the anxiety without producing sedation and hypnosis. Therefore, the such drugs which are used in the treatment of mental disorder, they are called as tranquilizer because they improve the specific mood and behavior of patient because of psychomotor actions. Now this is the one of the example, that is chlorpromazine is the example, or reserpine is also example, phenothiazine, trifluoperazine or haloperidols, all these are the examples of tranquilizer drugs. Now next and last one is the sedative and hypnotic drugs. Now what are sedative and hypnotics? Sedative and hypnotics, both the drugs are CNS depressant because they depress to the central nervous systems, and because of the CNS depressant, they reduces restlessness and emotional tension of the patient. Means sedative and hypnotics are the drugs which depress to the central nervous system and reduces the restlessness and emotional tension. But if we discuss the independently what is sedative and what is hypnotics, what are the difference in between them? The sedatives are the drugs which is CNS depressant that reduce the restlessness and emotional tension without producing the sleep. Means sedatives are the drugs which depress to the central nervous system, which acts on the central nervous system to reduce the restlessness and emotional tension of patient without producing sleep, is called as sedative drugs. Then what is hypnotics? Hypnotics drugs are also CNS depressant and it reduces restlessness and emotional tension with producing the sleep. With producing the sleep, such drugs are called as hypnotics. Means this is the difference in between the sedatives and hypnotics. Sedatives reduces the restlessness and emotional tension without producing sleep. Hypnotics reduces the restlessness and emotional tension with producing sleep. Okay. Now, for example, phenobarbital. This phenobarbital is used as a best drug as a sedative and hypnotics. When the phenobarbital dose is given to the patient up to 25 to 30 milligram, it acts as a mild sedative. But the same dose of this phenobarbital or the same phenobarbital is given on a 100 milligrams of dose. At that time it become hypnotics. Means the earlier stage is sedative and next stage is hypnotics. Means these drugs work on the central nervous system. They act on the central nervous system as they depress the central nervous system. But if their concentration or doses become changed, at that time they work differently. That is sedative at 25 to 30 milligram and hypnotics at 100 milligram. Therefore, and when the same drug, that is phenobarbital, is given in excess to the patient, when the patient is administered in excess or large quantity of this, then it becomes anesthesia. It acts as a anesthesia. Therefore, and in the next stage after the anesthesia at large dose, the patient become in the position of coma and it become poisonous, and after that the patient at the last stage of death. Means the while administering the sedatives and hypnotics, the care should be taken that the what at what concentration or what dose we are administering this tablet or drugs. means we have to follow the instruction which is given by the doctor, because the dose should not be changed as per our opinion. If the concentration of doses get changed, then it may get changes from first in the stage of sedation, next stage hypnosis, and next stage anesthesia, and at last coma and death. Then what are the examples? Alcohols, aldehyde, ketone, urethanes, urea, amides, barbiturates, hadantine derivatives. All these are the drugs which are used as a sedatives and hypnotics. And this is the structure of phenobarbital. And this is the difference in between the sedatives and hypnotics. Now, dear students, in this session, we have discussed about the functional drugs which stimulate or depress to the various function of body and get relief. We have learned about the antipyretic which reduces the purest temperature to the normal temperature. Then we have already learned about the action of antipyretic drugs. We have already discussed about the analgesic drugs. Then how these analgesic drugs are divided into two groups on the basis of their action, narcotic action. These are the examples. And this is anesthetic drugs, how it produces the insensibility to the vital function of all types of cell in our body with the help of central nervous systems, and how it is why it is used in the major and minor surgical operations as anesthesia because of temporal insensibility reversible effect. Okay, and these have been divided into two types or two groups, that is general anesthetic and local. Okay, and what are diabetics? Because of the deficiency of effective insulin in our body, the glucose level in the blood sugar get increases, our blood level get increases. That's why the patient become hypoglycemia, and he feels different types of symptoms: polydipsia, polyuria, glycosuria, ketonuria, weight loss, and muscular action. And because of this administration by the anti-diabetic drugs, the secretion of insulin is get increased. And this diabetic may be found in two stages: juvenile and maturity. And tranquilizers are the drugs which are used for the treatment of mental disorder, which improve the specific mood and behavior of patients. And last one is the sedative and hypnotics. Both are CNS depressant. It work without producing sleep, that is sedative, and it work with producing sleep, that is hypnotics. And these are the examples. Now, thank you, uh, dear all students. We will be stop here. The next part of this chapter we will be discuss in the next period. Thank you.